So I'm going to speak to you about what professionals does the health system of the future need. And I can already see from, my Greek is good enough to understand what was already presented, and Ilias, thank you for your running translations as well, that my presentation follows what people have been saying. Can I quickly check, how long do I have to speak? Is it 8 minutes? Okay, go quick. So I'm from the European Health Management Association. We're a membership organisation, and our vision is excellent health management for a healthy Europe, and our members are from all over Europe. You will notice, however, there's an opportunity there in Greece. We don't yet have anybody in Greece as a member of our network, and really our members are from all over the field that are interested in health management. Now, what I'm going to talk to you about today is really the challenge that we have in terms of health systems. So firstly, that 7%, health systems employ 7% of the European workforce, and that's about 5% of our whole population. What that means is 15 million people are employed in health systems across Europe. So we're talking about a lot of people. And we also know that digital and green revolutions are changing our world in a very big way. Like specifically, so these are actual photos of things happening in the world right now. This is an example of something in England where if you're to order your groceries online, robots will pack your groceries and have them delivered to you. That exists right now. Also exists right now, I'm sure many of you would recognize Ishiguro's work from Japan, where he has built an army of robots that right now are working as carers for humans, for elderly people, because Japan has a unique need for a workforce that doesn't exist. They can't import workers, so they have created them. Now, I've given you a pretty photo there. I like the provocation of that, but in reality, they're not humanoid looking. They still look like machines. But this is where the world is at right now. This is where technology has arrived. So that's a bit on robots, and of course, all the stuff on artificial intelligence that other speakers have spoken to is another big revolution. So that's digital, but thinking of green, we're also major polluters. The healthcare system produces far more waste than is right. What's interesting about our waste is that 85% of our waste is recyclable. 15% of our waste are toxic gases, are medical hazardous waste, but 85% is something we can do something about. And so really there's a challenge to the healthcare system to do something more responsible about the waste we produce, and we can no longer rely on the excuses that we have. So in recognition of this problem, we brought together quite a few people for a project called Be Well. And so Be Well is made up of partners all over Europe. It includes a partner from Greece, from the University of Thessaly. And otherwise it has universities, research organizations, and NGOs, people representing the professions. I'll go back a slide actually. People representing the professions, and also the unions are heavily involved, as are all of the faculties of health. So the general practitioners, medical doctors, nurses, pharmacy, health managers, anybody involved in the professions of healthcare are involved in this process. And it's really led by the professions. And the reasons it's led by the professions is we recognize the need for their lifelong learning. So absolutely building on the previous speakers who talked about continuing medical education, we're thinking of continuing medical education understood within the human right of people to have lifelong learning. So the Be Well project has several different really 4 key things it's looking to do. Firstly, we're wanting to make sure that we have the right intelligence of the real situation of healthcare across Europe. As we have the intelligence of exactly what are their learning needs and opportunities, we're building that into a strategy. So you'll see that second box there. So our strategy is building a blueprint so that we can make sure that all of our healthcare workforce have the skills of the future that they need. What's interesting, and for those of you that were here yesterday, you might have heard me reference this. What's interesting is this same project that we're doing for health is being run for 13 other ecosystems. So we're doing the one for health, there's one for fisheries, car manufacturing, aeronautical engineering, etc. And so this is a plan of the Commission to say we need everybody in Europe to have better digital skills and better green skills. So there's that square on the strategy. Next over here we're talking about a skills monitor, and we're also talking about piloting education. So actually, all these great ideas, we want to make sure that we run these ideas in real-life settings, and we test them out. In fact, it's University of Thessaly that is running our piloting programs to make sure that these new training programs work in reality. Sorry, I keep hitting the microphone. I'll take you back to this square here. So we're also building a large-scale partnership. So this is a technical term from the Commission, but its intention is to get people involved, to get organisations like yours, exactly like yours, to sign up and say, we agree with this dedication to empower our healthcare workforce, and we ourselves sign the manifesto to say that we will support this learning initiative. We have dozens of organisations signing up. It's a great opportunity for networking and connecting with other people with those same aspirations. We then take all of those people and we sew it back into the strategy. It means after 4 years of piloting, networking, grouping people together, we have a strategy that's built by the healthcare workforce, for the healthcare workforce, relevant to their future skills, built on an evidence base. These are just some examples of the digital skills. So I'll just leave that for a second. We're looking at really broad health digital literacy. We know that, kind of similar to what you were seeing presented earlier, about 61% of healthcare workers across all of Europe say they received no digital training in their initial training. So we know there's a big need here. So we're looking at broad health literacy, digital literacy training, broadly about digital literacy. Now if we go to what is the need for digital, let me jump ahead to where we're taking in the skills monitor here. So the skills monitor, as it's described there, is us trying to capture what are the different trainings that exist there. You've already heard about some today. And in our skills monitor, we're trying to capture all of them. I should acknowledge the work of Nivelle Research Institute in the Netherlands and the WHO Observatory on Health Systems and Policies. They're the ones who are producing this monitor. So if you have any courses that you know about, do send them to us. And the sorts of things that we're receiving are, like here's an example of the electronic medical records training, basic foundational training for people. So if you're interested in that course, you could go to the website, find the details. If you're an educator, you could then get in touch with them and ask how you could collaborate or learn from their materials. Or if you're a learner, you could find a way into that journey. An example of green skills is there's a course up there right now, Circular Strategies for Sustainable Healthcare. If you were to go and look at that site right now, you would say, there's not much there, which is because it's just started and we need more material. So I'd welcome you to send your material there. Okay, moving along now, and I've lost my notes, so bear with me 1 second. I'm showing you here some of the, here they are. I'm showing you here some of the, no, I don't have them, so I'll wing it. So I'm showing you here some of the examples of the in-demand green skills. And then I'll move on to, what are the green technical skills? And what I want you to understand here is we're not talking about new skills. We're talking about adding a green layer to existing skills. So we don't need people to retrain in something entirely new, but in order for us to get a better greening of our healthcare systems, a better ecological response, we need to look at these 4 categories. It involves personal skills, cognitive skills, it involves digital skills, that when you have those sorts of skills, but with a green mindset. And an example here is where you'll start to see some of the different professions that we'll start to see. It's the same professions that we've always had, human resources and whatever else, but they need a green mindset. And that's the main message that we're giving here is the green mindset. Okay. Finally, I want to show you some examples of what we're seeing in real life. So these are actual services that exist. We've got the green dentistry and green nephrology. And the way these came about was it was just healthcare workers in particular wards, in particular agencies saying, we're going to keep doing dentistry, that's what we'll do. We'll do it the way we've always done it. Dentistry is dentistry. But we're going to make more green choices, and that's going to be a guiding principle about how we procure new tools, how we purchase consumables, how we communicate with our patients. And that's applied everywhere in green nursing, green dentistry, green nephrology. And these are the sorts of changes that we're needing to see. And in order to achieve them, we want to see better curriculum, better training opportunities, like I've demonstrated in the monitor. Now, I'm showing you here a slide about the my organisation, Emma, we have our annual conference where we really have exactly these conversations. So if you're interested in further conversations about how do we manage these workforces in these ways, we'd love to see you at the conference. And in fact, there is such great practice here in Greece. It'd be great to see some abstracts from you around the practices that you've learned and developed. The conference for us is every June. Next year, we're in Bucharest. And then finally, I will give you some homework. So do check out the Be Well website. Everything I've said is there. You can also, I'd really encourage you to join the Pact for Skills, that group that I'm saying, be part of this partnership to meet your peers and share more practices. And then the strategy that we've developed, we're consulting on it in January for the whole year. There'll be an online consultation in 8 languages that includes Greek. So you can share it with your colleagues who might prefer Greek. Of course, the English version is there and several other languages. And it would be great to hear from you to make sure that this strategy captures all of that diversity that we've heard presented today and more. Voilà. Thank you very much.